Have you ever wondered if a computer, not a doctor, could spot a tumor before it even shows symptoms? Or whether an algorithm could predict which therapy might work best for you even before you begin treatment? What if I told you that the future of cancer care might depend not only on medicine, but on intelligence? Artificial intelligence. We stand on the brink of a transformation. AI is beginning to change how we discover, detect, and treat cancer. In this video, we'll explore the breakthroughs that suggest AI might not just help doctors. It might one day help us actually beat cancer. The power of prediction, early detection, and diagnosis with AI. One of the most promising promises of AI in oncology lies in early detection. Cancer's deadliness often stems from late diagnosis. By the time a tumor causes noticeable symptoms, it may have already grown or spread. But a major advantage of AI is its ability to sift through vast amounts of data, imaging data, genomic data, clinical history, and find subtle patterns that human eyes or intuition might miss. AI systems trained on thousands of scans, MRI, CT, X-rays, pathology slides, are now capable of flagging potential tumor-like structures with speed and precision. This kind of AI-assisted imaging doesn't mean replacing radiologists or pathologists. Rather, it provides an extra pair of very objective eyes that can catch the earliest signs of malignancy. For many people, especially those in remote or under-resourced areas, AI-based screening could dramatically increase access to diagnostics that currently require specialists or sophisticated infrastructure. Beyond imaging, AI can combine clinical data with genetic and molecular information to identify individuals at higher risk of developing cancer, potentially paving the way for personalized prevention rather than reactive treatment. In some research initiatives, scientists are using AI to analyze large population datasets to predict cancer risk, meaning doctors might one day be able to offer personalized screening plans based on a person's unique risk profile. From data to drugs, how AI accelerates cancer drug discovery and personalized treatment. But AI's promise goes well beyond detection. The complexity of cancer, with its many possible mutations, subtypes, individual patient differences, has historically made drug development slow, expensive, and often unsuccessful. Here's where AI brings a real revolution. By analyzing huge datasets, genomic data, molecular structures, clinical trial results, AI can help researchers identify new drug targets far faster than traditional methods. It can predict how different molecules might interact with cancer cells, anticipate resistance mechanisms, and narrow down promising candidates. This accelerates the process of drug discovery and reduces the time, cost, and risk associated with developing cancer therapies. Moreover, AI enables precision medicine, treatment tailored to a patient's unique tumor characteristics. Because AI can analyze multi-omics data, genomics, proteomics, tumor microenvironment, it can help doctors design treatment plans that stand a better chance of working for that specific individual. In some cases, AI-based tools can even forecast whether a patient will respond well to standard treatments like chemotherapy, radiation, or immunotherapy, and if not, suggest alternative or experimental therapies. In essence, AI is transforming cancer treatment from a blunt tool, one size fits all, into a personalized strategy where therapies are selected based on deep analysis of a patient's biology. This not only improves outcomes, but also reduces unnecessary side effects and wasted time on ineffective treatments. Optimizing treatment and care, AI as a clinical ally. Cancer care isn't just about diagnosis and drugs. It's also about treatment planning, monitoring, and follow-up. AI is beginning to play a role in these areas too, helping to optimize radiation doses, assist in surgical planning, and even adjust therapies on the fly based on patient response. AI's speed and computational power allow for rapid interpretation of imaging and genomic data, which helps oncologists make informed treatment decisions more quickly. For example, if a tumor shows particular molecular markers or microenvironment features predictive of poor response to a certain therapy, clinicians can pivot to alternate treatments earlier, potentially improving survival and quality of life. Furthermore, as cancer treatments often involve long courses of therapy and careful monitoring, AI can contribute through digital health tools, remote monitoring platforms, data-driven predictive analytics for adverse events or side effects, and decision support systems that help doctors keep pace with the growing flood of biomedical information. This kind of AI-enabled care promises to make oncology more efficient, reducing wait times, improving access, and tailoring follow-up care to each patient's needs. Real-world impact, evidence that AI is already changing cancer care. The potential of AI is not just theoretical, real advances are already underway. Researchers at leading institutions have developed AI tools that can predict how patients will respond to cancer treatment before therapy even begins. In one case, AI-powered modeling has identified tumor characteristics previously unrecognized as predictors of survival and treatment success. These insights could allow oncologists to avoid ineffective therapies and move more swiftly to better options. In parallel, AI-driven drug discovery pipelines are generating new candidate therapies more rapidly than traditional drug development processes. That means new drugs may reach patients sooner, and with potentially better targeted effects. Perhaps most importantly, AI's early detection capabilities and risk prediction models are expanding access, giving hope to patients who might otherwise be diagnosed too late. In regions where specialist radiologists or oncologists are in short supply, AI-assisted screening could become a lifeline. Taken together, these developments suggest that AI is not just a futuristic dream, it is already delivering real-world benefits in cancer research, diagnosis, treatment planning, and care. The challenges and limits. Why AI is not a magic bullet yet. Despite these breakthroughs, it's critical to remain realistic. AI in cancer care is not a magic wand that will instantly cure all cancers. Several serious challenges remain before AI can be considered a universal cure, or even a universal treatment aid. One major hurdle is data quality and access. AI models require massive, well-curated datasets, imaging, genomics, clinical follow-up data. In many parts of the world, such datasets may not exist or may be fragmented, inconsistent, or biased. Without high-quality data, AI predictions and diagnoses could be unreliable, or worse, misleading. Another concern is bias and interpretability. AI systems learn from the data they are trained on. If those data reflect socioeconomic, racial, or demographic biases, the resulting tools may underperform for underrepresented populations. Moreover, many advanced AI models function as black boxes, producing predictions without clear explanations, which complicates trust and accountability in a clinical context. There's also the question of infrastructure and scalability. Deploying AI-based cancer diagnostics or treatment planning requires advanced imaging equipment, robust computational infrastructure, regulatory approval, and trained personnel. In low-resource settings, these requirements may be difficult or impossible to meet, limiting who benefits. Finally, as with any medical innovation, there are ethical, regulatory, and privacy concerns. Handling sensitive patient data, genomic, imaging, clinical history requires careful safeguards, and the consequences of a false negative or false positive diagnosis from AI are profound. The bottom line, can AI cure cancer? The short answer, it might help us win. So can AI really cure cancer? Not on its own, at least not yet, but AI is fast becoming a powerful ally in the fight against cancer. It's enabling early detection, guiding drug discovery, helping personalized treatment, and supporting care delivery in ways we simply couldn't before. AI alone is not a cure, but it could radically increase our chances of curing or controlling cancer. It could turn what was once a battle fought in the dark into a fight with much clearer targets. It could shift medicine from treat the disease to prevent the disease, from one-size-fits-all therapies to right treatment for the right patient, from late-stage desperation to early-stage hope. If we combine AI's capabilities with human compassion, scientific expertise, and ethical responsibility, we might just be living through the beginning of a new era in cancer care, one where many forms of cancer become manageable, treatable, or even preventable. So here's something to consider, whether you're a patient, a researcher, a doctor, or simply someone interested in the future of health. What kind of future do you want? A world where cancer is feared and fatal, or a world where it can be caught early, treated precisely, and maybe even prevented? If you found this exploration useful, give this video a like, share it with someone who might benefit, and subscribe for more deep dives. Also, tell me in the comments, what excites you most about AI's role in cancer care, early detection, personalized treatment?